because shoulders is one of the areas where we often have problems. We often have what they call frozen shoulder, rotator cuff injuries. So that's very important to work these. So I'm going to have you bring it back again, okay, and open all that up, lifting the chest, and now I want you to bring it straight up. Press like you're pressing overhead and bring it back down. Press like you're pressing overhead, bring it back down. Press and down, press and down for 8, 7, 6, 5. Are you feeling the burn? 3. Muscles are working. And 1. Good. And bring it back. And just kind of relax. I think your shoulders were pretty warmed up right now. So let's go ahead and now let's get the wrist and get that involved, the chest muscles, and get those involved as well. So we're going to push forward, grab, turn, and bring it back. Push forward, grab, and bring it back. So let's go 8, 7, 6, 5, 4, 3, 2, and 1. Are you doing it with me? Are you doing it with me? All right. Yeah. Now, I want you to turn, bring it this way, because we also have different planes in which we function. So I want you to bring it here. You're going to turn towards your right, my left. You're going to bring this hand over, but notice I'm still turned this way. So I want you to bring it, so now you have to rotate that. And I want you to pull here and bring it over. So go 8, 7, 6, 5, 4, 3, 2, again. 8, 7, 6, 5, 4, 3, 2, and 1. How we doing? Let's try the other side. Here and here. So notice I'm still, this part I have to rotate. So here and here. Reaching and pulling. Here we go. 8, 7, 6, 5, 4, 3, 2, last 8, going. 8, 7, 6, 5, 4, 3, 2, and 1. How we doing? Doing okay. All right. So now, if it's okay, we're going to get out of this seat just a little bit, okay? We're going to get out of this seat just a little bit. We're going to bring it up. So we're going to go up and bring it back down. Up and bring it back down. Up. Hopefully I'm not out of the screen. Good. Up and bring it back down. Let's go. 8, 7, 6, and 5, 4, 3, 2, and hold. Can you hover just a little bit? Just a little bit with me. 4, 3, 2, and 1. How we doing? Warmed up? Getting there? Good. So, we're here. We're warming up our bodies. One of the things that we're doing now is we're warming up before we start pulling that muscle. When we get up in the morning, we may do a little stretch. But if you really want to do a stretch, that's significant, you gotta warm up those muscles first. Just like a rubber band that's out of the refrigerator, you don't just start pulling on it. You gotta warm it up. So, this is one where we're going here and come back, here and come back. And we will do that at a 4 count. So it'll be like 1, 2, 3, and that's 1. Okay? 1, 2, 3, like that. Okay? So nice and tall, chest out, shoulders back. Pinch those shoulder blades together so all of this is nice and tight. Abdominal region, here we go. 1, 2, 3, 1. 1, 2, 3, that's 2. 1, 2, 3, that's 3. 1, 2, 3, that's 4. 1, 2, 3, time. 1, 2, 3, 6. 1, 2, 3, 7. Now, think about it. I'm doing here and coming back. Not doing this. That's the difference. So I'm going here and turning. Here and turning. Here, I actually caught myself doing like this. If you're doing this, that's not really a rotation. You got to come here. So let's do it again. 1, 2, 3, and that's 1. 1, 2, 3, that's 2. 1, 2, 3, that's 3. 1, 2, 3, 4, 1, 2, and halt. Good. I don't know about you, but I got a little sweat going on. I have a little sweat going on. Now, again, nice and tall, working this core muscles. Now we're going to get into the legs a little bit to warm those up. So we're going to bring this up, bring this out, point and back. So that's 1, 2, 3, 1. 1, 2, 3, 2. 1, 2, 3, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3, 6. 1, 2, 3, 7. 1, 2, 3, 8. 1, 2, 3, 9. 1, 2, and halt. How are we doing? Did you feel that?
Yes.
All right. So let's do it again. Other side. 1, 2, 3, 1. 1, 2, 3, 2. 1, 2, 3. 1, 2, 3, 4. 1, 2, 3, 5. 1, 2, 3. 1, 2, 3, 7. 1, 2, 3. 1, 2, 3. 1, 2, and halt. Should feel a burn right in here. Warming that up. Nice deep breath. Good. Would you say you're warmed up? We're going to bring it here, bring it up. Deep breath. I want you to bring this right arm, have the elbow pointed to the ceiling as much as you can. Grab it with the left hand and just bring it over just a little bit. Just a little bit. And bring it back. Same thing to this side. Bring it up and bring it over just a little bit. Good. Deep breath here. We're going to bring it over. I want you to have one hand here. We're going to reach, opening up this. Okay, opening all that lateral chain of muscle. And then we're going to go the same thing to this side. Okay, here we go. 1, 2, 3, 1. 1, 2, 3, that's 2. 1, 2, 3, that's 3. 1, 2, 3, that's 4. 1, 2, 3, that's 5. 1, 2, 3. That's 6. 1, 2, 3. That's 7. 1, 2, 3. That's 8. 1, 2, 3. That's 9. 1, 2, and tall. How we doing? Doing okay? All right. How we actually doing them? All right. I know I'm getting a workout. Okay, so what I want you to do now, a little isometric contraction here. I want you to push here and push out and pull in. Push out and pull in. Push out, pull in, push out, pull in. 8, 7, 6, 5, 4, 3, 2, and hold. Now just go from this side to this side. Nice and easy. Working those wrists, stretching out those fingers, those hands. Nice and tall. 8, 7, 6, 5, 4, 3, 2, and stop. How are we doing? Deep breath. Bring it here. Right leg forward. Sitting up nice and tall. I want you to take that left hand, start at the knee. Some of us will stop at the knee. Lifting your chest, edging so closely, and go down as far as you can. Get a nice stretch here, and bring it back up. Same thing to this side. Reach down, nice and tall, reaching forward, and bring it back. Good. Deep breath. Bring it here, and bring it down. Here we go. Got my knees apart. I'm here. I want you to bring it up and bring it back down. Bring it up and bring it back down. Bring it up, deep breath, and bring it back down. Bring it up and bring it back down. Let's go. 8 more. 7. 6, 5, 4, are you with me? 3, 2, and 1. Nice and tall. Deep breath. Good. Just to make sure that we got these wrists going, I want you just to wring out the towel here. Just wring it out. Good. Nice. 8, 7, 6, 5, 4, 3, 2. Now, back to the lower legs. So I want you to come up on the toes and come back to the heels. 8, 7, 6, 5, 4, 3, 2, and 1. Good. How are we doing? Let's do this. Bring the foot across. Hug it real tight. You can see I'm tight here. Lean forward. And just get a nice stretch. Right stretch. Good. Other side. Bring it in. Get a nice stretch. Keep it going. Nice and tall. How are we doing on time?
28, 22.
28?
22.
22. Okay. Let's bring it back down. All right. Now, deep breath. Good. How are we at standing? Can we stand a little bit? All right, let's bring it up. Now again, we're talking about stimulating and keeping track of your lower back muscles, especially the lower back, the glutes, and we tend to have pain in the shoulders and so forth. So what I want you to do is, if you're sitting, you should be sitting in a chair, I want you to get up, go to the back part of your chair, and I want you to hold on to this chair. But I want you to come to an erect posture. I want you to bend this knee, this down knee, so this would be your right knee if you're facing it. So your right knee is slightly bent, and now you're going to lift that back leg, squeezing the glute, and come right here and reach. And bring it back. Let's do it again. Reach, and bring it back. Nice and easy. Reach, and bring it back. Stimulating, strengthen that lower back. Reach, and bring it back. Last one on this side. So, this is my right leg, your left. Nice and tall, shoulders are back, glutes are tight. So we're reaching, and bring it back. Good. Reach, and bring it back. You're getting a stretch in that hamstring, and you're strengthening the lower back. Reach, and bring it back. And bring it down. I spilled my water a little bit.
Oh, that's fine.
But deep breath here. Good. And let's stretch it again. Stretch that lower back just a little bit. We just stretched it, and bring it back. Other side. Good. Deep breath. Good. And I want you to bring it back again, nice and tall, holding on to your chair, lifting the chest, expanding the chest, opening up the rib cage here, and that's relaxed. Take a deep breath. And just listen to your body right now. You can feel the blood flow going through. You can feel, for me, I have some, you may not see it, but I have some perspiration going on. And when that happens, I feel better. And I hope you do too. So, thank you. And I'm open for any questions that you may have.
Okay, Art, we're going to have a little question and answer. Does anybody have any questions for Art?
All right, what does it mean when your bones crack while you do the stretching?
Good question. There's something, sometimes we have things called crepitus. Crepitus meaning that there's in the joint, there's friction going on. And there's bone, sometimes the cartilage and so forth is bone on bone. I would definitely, if it's not causing you too much pain, or if it's not causing you pain, then I would just go with it. But if it's causing you discomfort and so forth, I would definitely see a doctor. But anyway, the best thing to do is to see someone about it. But when you have crepitus, that can be a normal part of aging.
Anybody else? Any other questions for Art?
Yeah, can we get together and do every day?
I heard that. Did you like it? You liked it?
Yeah, it stretches you right out, that's for sure.
Wow, awesome, awesome, awesome. It lets you know that you don't have to. Actually, to me, this is like what they call movement preparation. This helps me. If I take time to do this, then the rest of my day kind of flows. It's sort of like doing your worship, you know. You can deal with what happens. Yeah, the aches and pains seem to not be as bad.
Asking if you have a YouTube.
So Sebastian, did you record this?
Yes.
So will you be able to put it on the website?
Yeah, we can. Yeah, we can do that.
All right, if you heard Sebastian, he can put it on the website. We'll get it up on ltflagler.org or .com. So you'll be able to.
They're asking if you have a YouTube page.
Now,
I do not. My daughter, I have to talk to my daughters about a YouTube page. Thank you. But yeah, I have to talk to my daughters about setting that kind of stuff up.
YouTube page.
Yeah.
This is Maxine. I wanted to thank you for the exercises. I just did a 13.5-hour shift at work and came home and decided to try to hop on, at least catch some of this hour. And if I didn't hop on, I probably would have just been sitting here, and it really did feel good to stretch.
Awesome, 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 awesome. I'm glad. As I'm running through my mind, and you know, I think about the stretches that we can do, the things that we can do to actually really stretch. What we mainly did, honestly, is called movement preparation.
Welcome to the family of God. My name is Dr. Mark Brown, and I know that you are blessed to be alive today. The world has become such a challenging place, and we are all bombarded with decisions we need to make constantly. Since March of this year 2020, the coronavirus has caused many drastic changes, one of which is having to work from home, as well as having the children go to school from home. Today I have with me Dr. Oteni Hamilton and his wife, attorney Natalie Hamilton, who are parents of 3 wonderful children. I want to thank you both for consenting to share a little of your life along with coping skills for your family. Welcome to our Week of Prayer program. Could you both tell us a little bit about your routine prior to the corona pandemic?
Thank you for having us, Dr. Brown. Well, before the pandemic, we pretty much had a pretty good routine going on. We got up at 6:30, 6:45-ish, got the kids up at around 7 for them to brush their teeth and get dressed and eat. And we do the same and try to get out of the house by 7:30, 7:45-ish. Dropped off the youngest one first. Well, not the youngest one, the middle one first, which is Adea. And then we drop Asia off, and then I'd go on to work. And Oni got to stay home with grandma. And then we would go through our day. I'd go to work, they'd go to school, and I'd pick them up after I get off work. So probably.
So Natalie, it sounds like you were the one who basically had to get the children ready and drop them off to work.
For the most part.
Tell me what part, or Dr. Oteni, what part did you play in this?
I played a very supportive role. I was a behind-the-scenes cast member. My work schedule doesn't allow me, unfortunately, to be able to participate as much on my weeks on, but on my weeks on, I would try and take the girls to school. I can at least drop them off. So Natalie would mostly get them prepared and ready. And then on my weeks on, they jump in the car with me and I drop the 2 girls off to school on my way to Vero to work. But again, Natalie here did take on a majority of the role, picking them up from school. They both are involved in extracurricular activities like gymnastics and play. And, you know, she'd be there to pick them up and bring them home and get them started on their schoolwork before I'd even return from work.
Tell me what age children are we talking about?
So we have a 9-year-old, that's our eldest, a 5-year-old, the middle, and our baby boy is a year old.
Wow. Go ahead, Natalie. You were telling me a little bit more about the routine. So
Yeah, so once we pick them up from school, got them home, get them take a shower as soon as they got home, and then get started on the homework portion of it. Asia would get some of her homework done at gymnastics because they had homework time where they went to help them with their homework. So she got most of it done there, and then I would check it after she takes her bath and everything. And then they would eat, get a snack, and they have to get a snack no matter what time it is. Even if they just ate, they needed a snack before bed. So they got a snack. That's usually their way of stalling and not going to bed when it's time. But they're pretty good. So they're usually in bed by 8:30. They're in bed so that they can get enough rest for the next day. So yes, usually they're probably in bed and sleeping by the time Lieutenant gets home because of his schedule. Usually he works at 10 to 10, so they're usually sleeping by the time he gets home.
wow,
And yeah,
wow.
and then we get stuff ready for the next day while they're sleeping, get their lunch, snacks and everything ready, and the uniforms that they wear ironed for the next day.
Okay, so Natalie, tell me, were you always going to the office, or were there days when, prior to the pandemic, that you worked from home?
Well, actually, most of the time I was going to the office. We had the option of doing a couple hours from home if we wanted to, but it never really worked well for me. So I never really took advantage of that option. So I would go to work or go to the office or go to the courthouse. So when I leave, usually I pick Asia up and I'll take her to my office on the days when she doesn't have gymnastics. I'd pick her up and take her back to my office until I got done, and then I'd leave and come home and pick up Adea. So most of the time it was either at the office or in the courthouse.
Oteni, I know that you basically never worked from home because you have to see patients. I know that some patients are being seen now from home, but were you ever working from home?
Unfortunately, no. In my particular role, I wasn't able to take advantage of the telehealth examinations. I work in the inpatient setting in the hospital, admitting very ill patients. Most of the outpatient doctors, your family practice providers, your pediatricians, a lot of them have been able to take advantage of the teleconferencing to evaluate their patients, and it's been a huge benefit. We've actually seen that this is something that's likely to continue post-pandemic, just like all of our workplaces. It's proved to be a vital asset and increased our access to the patients. But in my particular role, unfortunately, nope, I was in the hospital.
It sounds to me like, of course, you had a typical parent-children setting prior to the pandemic, where you would get up and, of course, get your children ready for school, get yourself ready for work, drop them off, and go back, pick them up. Tell me, how has this corona pandemic changed that routine? What has changed because of all of this?
Well, I work predominantly from home now. I've actually been to the courthouse twice since March.
Wow.
Yeah, twice since March.
Whereas you used to go every day, is what you're saying?
Pretty much, yes. At
Okay.
least 3-4 times a week to the courthouse. Now I've been there twice since we've just recently opened up to going. We're still not going fully, so. But so most of this is working from home, which at the beginning I thought, wow, this would be great. I get to stay home, I get to sleep in a little bit later. This is going to be awesome. Well, let's just say it's not as awesome as I thought it would be. Because, halfway through, I'm like, man, I wish we could go back to the office. I wish I could get a break, just not be in the house. So it has changed a lot because then everybody's home and everybody wakes up. Well, I won't say everybody wakes up at a different time. Adea wakes up first, and she wakes up everybody else after that. So once she's awake, everybody else is awake. And so with school starting back, routine, we try to set a routine even though they're going virtually. So we make sure they wake up, they get breakfast ready, eat, and then of course everybody has to find a laptop to log into in order to start. So it's a little bit tricky because everybody is in the dining room, which is not very large. So we're all sitting in the dining room, and it's kind of hard because we have 3 computers going and 3 people talking, and Asia's teacher's talking, Adea's teacher's talking. I have the cord on, and I have to hit mute and keep it on mute most of the time. So that's kind of tricky. We've since adjusted, gotten them headsets so that we're not hearing everything from their computers. But it's kind of hard to get everybody ready because Asia starts at 8:30. So we get her on first, and then Adea starts at 9 o'clock. So I have to log her in at 9 o'clock for her to watch her teacher. And then if I have any trials or cases coming up, I have to do the same, log myself in and be ready to go.
Were these computers that you had prior to the pandemic, or did you have to go get these computers after? Did the school provide these computers for the children?
So back in March, when this first started, the district didn't have enough computers to give to students because they would give 1 computer per family. So if you have 6 kids in a family, you had 1 computer from the district, and that was it. So we actually purchased a computer for Asia back in March. Well, it was my computer, but we gave it to her to use.
And Asia is your oldest child?
Yes. Okay. And Adea, she didn't need a computer at that time because she was in pre-K. So we just pick up the packets from the school, and then she would work on packets. Since then, since we've opened, her kindergarten class is now virtual. So then she's using the computer that Asia used back in March because the school district was able to buy a computer for everyone. So we got a computer for Asia from the school district. So Asia is using the school district computer. Adea is using what used to be my computer, what is my computer. And then I use my computer, my laptop from work. So we have 3 computers going at the same time.
Wow. Wow.
Yeah.
And
yeah.
So your dining room has become a classroom, multi-grade classroom, and also an office.
Yes.
Tenny, do you sometimes envy not being home?
0% of the time do I envy Natalie being at home. It's a difficult task, and I appreciate all that she does. I mean, from morning until evening, there's just no stopping. There's just, it's one thing when you're not in the house with everybody. It's a little harder for people to get to you. They have to call you. You're not immediately available. But mommy's sitting in the room next door now. We just go to the room, so it's constant. She's just always on the go. So it's a difficult task, but she does incredible at it.
So your dining room / office / multi-grade classroom has transformed your house into a school and a workplace all at the same time.
Correct.
What did the pandemic teach you about your children that you didn't know?
Well, let's see. Asia, not really anything, because Asia is the same,
Asia is the oldest one?
Yeah. She's passive, so she's done the same thing that I've seen her do throughout. But Adea, definitely. I did not realize how stubborn and strong-willed she was. Like, I was like, have mercy. I'm pretty sure she doesn't do that at school. It's just because it's mom, but she is one strong-willed little girl who is going to get her way no matter what. So especially with her, it's hard when I'm on the courts because when she wants something, she wants it now. It doesn't matter what I'm doing. It doesn't matter that the judge is in front of me. She wants an answer to whatever she's asking. She wants it now. And she'll tell you, I don't like patience. You say, have patience and then wait. She'll tell you straight up, I don't like patience.
Wow.
I want an answer now. And it's like, yeah, she is.
How are you able to cope with that? I mean, if you're in front of the judge, what do you do?
Majority of the time, my screen is on, because we use Zoom. So majority of the time, I keep it on mute and I keep the camera off. When I need to speak, I'll turn off I'll unmute it and then I'll put my camera on so they can see. But apart from that, I just keep it on mute and the camera is off. And thankfully, I work with a judge and people around me who are understanding. They realize most of us have kids, and so they're understanding of it. And so last Friday, I was on for a hearing, and Oteni had to go to work and grandma had an appointment. So I had all three of them and the baby, and I had to hold the baby in my hand while I was on court, with the screen off and everything. And of course, right when I unmute to talk is when he decides he wants to talk too. And I was like, I had to be quick with the button, but sometimes they're hearing me and they're hearing him. And I got a text message on my phone while I was on there saying, was Oni sworn in? I see he's testifying. Did we get? And I was like,
and
yeah.
Oni is the baby.
Yes, the 1-year-old. Was he sworn in before he started testifying? Because he just started talking when it was my turn, and I was like, I couldn't do anything. So thankfully, I have understanding people who I work with, and the judge at the end, he's like, Miss Hamilton, do you need help over there? Do you need me to send somebody over there to help you? Sounded like you need some help. So my judge is pretty understanding, and so is everybody else. So it makes it a little bit easier on me while I'm working from home, and I have to maneuver all three of them.
So let me ask you: is it ironic because I think you deal with families and children?
Yes, I do. Exactly.
So tell us a little bit about that.
Well, yeah, I do dependency. So my program gets appointed whenever a child is removed by the state from their parents. My program, the Guardian Ad Litem program, gets assigned to the child so that we can look out for the child's best interests during the pendency of the case. So it is ironic, and lots of times, we joke with each other. We're like, well, you better be careful. Make sure you leave here and go get your child on time, else we're going to have to call, DCF on you, and you'll be here when court runs late. So it does help that they realize that we're in this dealing with children. And so that I think that's where the understanding comes from, that children are going to be there. They understand children. They're not going to be perfect all the time and do what you tell them. So it makes it a little bit easy in this process.
Oteni, I know that you have a week off. I think you have a week on and a week off. Is that how that schedule goes?
Yes, I do 7 straight, so a week on and then the week off. And in my week off, that's when I'm best able to assist and kind of try and take lead for the week, just to give Natalie some reprieve, though I'm not as good at it as she is.
Let me ask you this: Have you learned anything about the children when you have your week at home? That's something that you didn't know before.
Well, again, I realized just how much it takes to continually redirect them. They're very smart children. They're actually not bad children at all. They're great kids. But being at home, there's so many things that can distract them when they're to be doing their schoolwork. That's the majority of the task. It's just, hey, stop looking at the TV, come back, sit down at the computer, listen to your teacher. So I've learned that they're all willing to learn. They're all very intelligent, but they're children. And when there's a lot of distraction, you know, their attention span is 2 or 3 minutes, and I'm just continually trying to redirect them to get them through their course for the day.
So is your experience the same as Natalie's with, she mentioned the middle child being somewhat of a strong-willed child, lacking patience. Is that your experience also?
That is my baby girl. Coming into this world, she had to fight. She was, you know, an emergent C-section. She was in the NICU for over a week with a tube in her nose. So she's been molded into somebody who is, you know, going to make sure that her will is known and that she fights. But at the same time, she's a bit of a sour patch kid because she is the sweetest, gentlest soul when she wants to be. So I definitely have experienced both sides of her.
I won't bother to ask what side of the family did she get that from.
We can testify if you like.
I don't want to break up a happy home. So let's just leave it there. Let me ask you candidly: are both of you just waiting with bated breath for school to be reopened so that you can send them off back to school?
Yes. For sure. Trust me, I've gotten halfway through the day and I said, Adele, go put on your clothes. I'm dropping you off at school now. I said, I don't care. You are going to school this minute. Because she would sit there and find everything else to do except her schoolwork.
Wow.
And yeah, everything else except the schoolwork. And she'll tell you, but mommy, you said playing is good for the brain, so I just want to play right now. And I'm like, Adele, there's a time to play, but now it's school time. No.
So that's definitely something we had to weigh when we were making, you know, that decision. You know, are they going, you know, back to school, or will we be taking advantage of the distance learning via the internet? Because as we said earlier, you know, being at home all the time, it's another full-time job. Particularly, say in my situation. So when I do 84-hour weeks, and on my week off, you know, you'd like to sleep for a day or two in total before being on it again.
Yeah.
And, you know, I don't get that luxury when they're at home. So I find myself now, what you would say, chronically fatigued, just always kind of just a little tired. But, you know, our children's safety is paramount. And for that, you know, we're responsible and we have to sacrifice. And thankfully, we were put in a position where Natalie is able to work from home, where grandma, my mother, is here and can help us. So we did choose to keep them and do the distance learning.
Are there some things that you're going to put in place when school opens and they return? Are there some safety measures that you're going to put in place?
Sure. I think like when we first, when we had the baby, the big thing was, okay, every time we had a baby, we had somebody who was in school, it's like, okay, when you come home, the first thing you do is go to the bathroom, go bathe, change your clothes. So it's kind of like the same thing. You're coming from school, you come in, go straight to the bathroom, change your clothes and bathe, you know, before you come in and mingle with everybody else in the house. And so I think we're going to continue to do that once they go back to school. They do know that they're supposed to wear masks. And I think it's just practicing with them how to wear the mask properly when you do go back to school. Because I think part of the thing is a lot of kids are wearing a mask, but they don't wear it properly either. It's the same thing with teachers, because I've seen in the classroom where the mask is on, but it's below the nose, or it's just all over the place. And they're kids, so that happens. So it's just teaching them how to make sure they keep that mask on properly and they're washing their hands as often as possible when they're in the classroom and when they're home.
For myself as well, we've in the midst of the pandemic, I had to change how I did with transitioning between work and home because, before pandemic, we go to work, I see my patients. At the end of the day, I come home, my kids come, everybody wants a hug because daddy came home a little early, and then I would hit the shower. In the midst of this pandemic, not only have I been wearing different clothes to work and home from work, I change in the hospital. Once I get home again, I disrobe in the garage, essentially. Everybody knows, don't touch daddy. He's going straight to the shower. And then, 5 minutes after I'm home, then we get all the hugs and the kisses and they get some endearment and playtime. But again, I don't think that that's a bad thing to continue because being in the hospital, I am exposed to different things, some unknown. And it kind of just brought it to the forefront of our minds in the midst of this pandemic that might not be a bad thing to continue. So for the safety of our family, we'll continue that as well.
Great, great. Natalie, I know you did some teaching before you became an attorney. Are there any coping skills that you could share with our listeners as they deal with having to teach and having to work from home?
Sure. I don't know. I'm finding coping skills myself because, like I said, it's hard. It's like having 3 jobs when I'm home now because I have to do my job that I'm getting paid for. I have to be a teacher, and then I have to babysit the little one too. So, but I think it's important to make sure you keep the routine because kids like routines. And if you are allowing them to wake up whenever, and every time they have a break, you say, okay, go watch you can watch the TV. Then it gets difficult for them to transition back. It's harder to pull them off the TV and transition them back when it's time for class to start. And then they'll start missing classes when they're supposed to be on there because, oh, I forgot while I was watching the TV, or I forgot while I was doing this. So I think it's important to keep the routine, let them feel like they're in class all day long like they normally are, and keep those routines so that they don't get distracted by the other things that are around because they're home. All their stuff is here. And so it's easy for them to get distracted and try to run to their room to go do this and all of that. And I think it's also important to put them in an area where all their stuff is not there. So they don't have access to it or they're not distracted by it. So that's why we put them in their toys, their electronics, everything they want to, get distracted by. So that's why we have them here in the dining room where the only thing is their books, their textbooks, and school-related items are in here at this point in time. So I think that's one of the important things, to keep the routine going and make sure they feel like they're in a school environment.
So what I think I hear you saying is that making sure that you're firm, you're fair, and you're consistent are 3 major components of having to deal with the children and work at the same time. Yes,
and I want to point out, Pastor, you said the word fair. Fair means different things to different kids. When you're talking to my kids, okay? Because they will tell you, Mommy, it's not fair. Look, Asia is on a break, so she's watching her teacher gave her a video to watch, and she's like, but it's not fair that she gets to watch a video. And I'm like, but it's for school. Well, it's not fair. I want to watch a video. How comes I can't watch a video? And it's like, because that's not what your teacher gave you to do. You have your set of things to do, and you need to focus on those, and don't focus on what your sister is doing. So fair is fair too. It depends on who you're talking to or which kid you're talking to at that time.
But you've got to make sure that you define fair in your terms,
right?
And also meet them part way.
Yes.
I know consistency is also a very important and integral part of having these kids in the house while you are doing your work also, because if they're not into that pattern, then it's easy for them not to comply when you want them to comply.
Yes.
It's got to be very challenging. Is there an encouraging word that you have for other parents out there? Both of you
don't be afraid to take a break. Listen, I try to stay home because I don't want to mingle and co-mingle with everybody. But being able to go to the supermarket and walk around for 20 minutes is a breather for me. Because then I can leave them at home, do what they're doing, and I'm out there and I can take a breath. I can get a break from everything going. So just don't be afraid to take that break that you need. Set them aside, go walking up and down the street or whatever you need to do just to give yourself a break, because it's a lot to do all at once and to do it consistently every day. You don't get you don't get that break. At least when they're in school, you get a break throughout the day from them, and then you pick back up. There's a separation between your work schedule and then having to come home and be mom or be a parent. You get a break from that, which you never thought of as being, wow, that is really helpful and necessary. But when you're with them all day long, then you realize it.
So just like at work, most work places, maybe not Otenis, but most workplaces give you a 15-minute break time in the morning and a 15-minute break time in the afternoon.
Exactly.
You're saying to me that it is essential even when you are home,
yes,
so that you don't go off on the kids and then they turn up in your courtroom.
Exactly.
Is that what you're saying?
Exactly.
Or these kids don't end up in the ER seeing your husband. So, yeah, that's important. Tell me, is there, as we wrap up, is there something that you learned about yourself? There are things that you learned about the kids, but is there something that you learned about yourself during this crisis?
Yes, I have even less patience than I thought I had.
Okay.
So I guess I'm out to myself that the whole patience part on Adea's part is probably from mommy. A lot less patience than than I thought I had, but I had, I'm adjusting to it and making it work. But I guess I see that I'm still resilient because I get up and I do it and I keep doing it over and over. And as long as it's needed to be done, I will continue to do it because that's why my kids need to be safe. That's why we need to be safe. We have a young baby in the home. We have grandma in the home. And so I will continue to do that. And so I'm working on the whole patience part of it along with Adea. We're working on it together. She's working my patience daily. And so it's increasing thanks to her.
So she's helping you to be saved because you can't be saved without patience. Because it's
yes, sir.
Here is the patience of the saints. So
yes, sir.
There's a salvific angle to this, as God is allowing her to help you to be saved. Oteni, anything that you learned about yourself during this crisis?
Well, again, that we are adaptable. We can take a sour situation, make the best of it, and still be successful. We've also learned that we're not alone in it. And this program that you're doing is important to point that out. There are other parents that are struggling with the same challenges with their children, their work environment, and this new normal that we're now facing. So try not to feel overwhelmed. Reach out to your friends, your fellow parents, your extended family, your church to see if there's any other support that you can have so that, in this endeavor, you as well can be successful.
Great. And of course, as a doctor, I'm sure you would encourage everybody to make sure that while they mingle, they're still doing the proper procedures for being safe.
Absolutely. Absolutely. So our social distancing and the CDC guidelines are still important for us to observe. I know a lot of people start to feel a little more relaxed now that we see that, the cases aren't as prevalent as they were just a few weeks back. However, I would admonish us just to continue being safe. Let's use our brains. Let's not let our guards down too quickly. But again, we all kind of have cabin fever now because we've been locked up for months. So I can understand us itching to kind of let our guard down. But again, let us just be safe as we kind of bring this pandemic to a close.
Thank you very much, Dr. Hamilton. Thank you very much, Attorney Hamilton, for sharing just a little bit of your family life with us. And continue to pray for us and continue to pray for all the other families that we will be safe. I know the children are many times a stressor. Work by itself is a stress, but the children add to that stress when we are home with them. But by the grace of God, we will make it through. Again, thank you both very much for spending this time with me. And I also noticed that it has been quiet. So Grandma is probably waiting with bated breath for you to come get the kids. God bless you all. Thank you very much for sharing with us.
Thank you for having us.
Welcome again to another evening of the mental health segment for this week's Fall Week of Prayer. I'm happy you could join us. I always am happy to be able to connect with others and talk about things that are helpful for life and living. Again, those who may be starting for the first time with us may not know who I am. My name is Andrea Gibbs Brooks. I attend the Emmanuel Seventh-day Adventist Church and the first elder there, and also co-lead the Family Life Department with my husband, Walter Brooks. I'm a professional and nationally certified counselor, and relationship is something that's very deep in my heart. Family relationships, individual relationships. God made us to be in relationships, and I believe that from the bottom of my heart that He wants us to be able to function to the best of our ability in this sinful world till He comes again to make creation what He intended it to be originally. The goal of this mental health series again is to help us to build resiliency and to provide helpful information to help us get through this pandemic. We have highs, we have lows. We've talked about depression, we've talked about anxiety, we've talked about fear, we've even mentioned guilt being a part of things that help us to be depressed. We're just covering a smorgasbord of topics. But of course, my heart goes very deeply to relationships, because that healthy relationship is the key, the foundation to a healthful person, healthful home, healthful church, healthful society, or healthy, I should say. When we have healthy relationships, then things begin to go well even with our body and our mind. And we know that healthy relationships, I do believe, is a key to a healthy everything else out there. So we want to continue to build each other up. Tonight, we're going to talk about families and communication. We're going to kind of cover those two in one tonight, about family bonding and communication. And we know with the COVID pandemic going on out there, we've had a lot of family time together. And as one friend mentioned, it brings us together. And then others who, because we were apart before due to work and school and other activities, but it also, some of us who feel like it's too much togetherness. So we want to just talk about family bonding this evening. Let's go ahead and bow our heads for prayer. Okay? Father, we come tonight asking you to be with us. I thank you that you are with us. I thank you that you're with the program. You're with this entire fall revival series. We need you, dear Father. In this time of earth history, we need an extra undergirding of your spirit and an outpouring of your spirit, Lord. We need more of your love. We need more of your sustenance, because we are facing such critical and such complex times. So, Father, be with us. We talk about bonds of love, family love, communication in the home and otherwise. And Lord, may each of us get a blessing this evening, we pray, for Christ's sake. Amen. All right, bonds of love, family relationship building. Now, I know, as we have said before, a little bit earlier in the prayer, in the introduction, that we're having a lot of family time. Some of us. Others have said, this is too much family time. because this has gone on for so long. Others are saying, oh my goodness, I love this. We didn't have time together. You know, I see it all the time on YouTube and on the news. People are being creative and innovative. We have singers that are singing from the home, families doing songs together on the internet. Wow. So we have seen the positives of the pandemic in bringing people together. We want to talk a little bit more about bonds of love, growing together as a family God's way. All right. So what does it take to build healthy relationships in the home? Between husbands and wives, between children and parents, between brothers and sisters. What does it take? And I know people are probably out there giving answers. Remember, by the way, if you need a pen or a pencil and a piece of paper to jot things down, make sure you jot some things down. But answers about what does it take to make a healthy relationship between husbands and wives, siblings, between parents and children. People might say love. And that's true. Communication, great one. Great one. Listening, speaking, giving understanding, empathy, and this is for adults and children and people that we deal with. Forgiveness. That was our topic last evening, about giving forgiveness, because that is a great and vital piece of having a good, healthy family. Respect for one another, right? Respect is very important for each individual, whether adult or child, male or female, young or old, and showing appreciation. So we're going to cover some of these, as many of them as we can, in our wrap-up session. If I miss anything, we'll go back and do that in our wrap-up. But we want to at least talk about the communication pieces, all right? Communication is the key. Family members must be able to communicate love using words and actions. Now, you've heard it said that, families, or anyone, to show love, we want to see actions. Because somebody says, I can't hear you, what you're saying, because your actions are speaking louder than your words. And sometimes we can use words, but our actions don't show it. Now, our text this evening, of course, is Genesis 2:18. It's one of my favorites. And again, I'm just paraphrasing, but the core of what we're thinking, each evening we try to give a Bible text, because God's word is foundation to whatever we do, to our health, to our healing, both physically, mentally, and spiritually. God is the key. So for Genesis 2:18, when God said, it is not good for man to be alone, but he was going to create a helpmeet for him that was suitable for him. Now remember, Adam at the time had a beautiful home that God created, and Adam had God. But God, who is God in relationship, God the Father, God the Son, God the Holy Spirit, who said, let us create the world, let us create man, that God of relationship said, Adam, you've got animals, you've got trees, you've got fruit, you've got all of this accommodation, but you need somebody like you. Even though you have me, somebody like yourself. So in words and actions, we're going to talk about that institution that God made, the family. Now, if we can get communication right in our homes, we can get it right outside as well. So we're going to talk about family. Family, when it comes to love, you can't have love without the action. Because, and I love to say it, love without action is dead. When I'm doing workshops, when I'm talking to couples or singles who are looking to get married, I share with them that we say love, I love you, but then somebody says, okay, I love my cat, I love my dog, I love, spaghetti, I love a vegetarian burger, whatever it is. But love without action is dead, because I can say I love you and my actions don't show it. But when I love someone, my actions show caring, my action shows empathy, my action shows acts of service, different things that show that I love, that when I speak with my lips, I mean it. All right? So love and action must go together. Each person in the family must be able to speak with openness and honesty. And there's a lot of stress going on now with this COVID-19. The children are home. They're missing their friends. They're grieving. They're becoming depressed. Remember, we talked about that. People who have lost jobs are depressed, but want to be able to share openly and speak honestly about where we are. Want to set aside those times apart from schoolwork, apart from doing what we have to do if we're working from home virtually, where we have family time for people to work through some of these things. Because in the family environment, that's where we can get the best opportunity to be able to fight off some of the things that come that affect our health negatively. So to keep us from being depressed, be able to share, to keep us from going through long-term anxieties and fear, talking to our children about their concerns for the future. So we want to listen with caring and compassion to whoever it is that's speaking. So there are two parts to communication: in the home and otherwise, speaking with openness and honesty, and listening with caring and compassion, which is with empathy, putting yourself in the other person's shoes, not just listening to respond, but listening to understand and get the depth of where the person is coming from, becoming that person, so that you're not thinking as yourself, but to be able to think in a way that says, I hear, genuinely sense, and care about what the person is saying that's speaking to me. So each family member must be able to express their experiences, their feelings, their concerns, their desires in a safe environment. So we're home with the COVID. Now, each person is different, and we're going to talk about personality styles in another section, so I don't want to dwell here, but each of us are different. We said that when it came to grieving, when it comes to how we feel anxious or handle fear, how we handle our depression, or how we come in and out of it. All of us are different, but we want to be able to share ourselves, become vulnerable in a safe environment. And so a home is a place to do that. We need to be able to do in the home, be vulnerable in the home, safe in the home, to speak, to share, and then to be affirmed in the home. You know, affirmation comes from only in the home. I don't know if you know that. We have affirmation. We can get a certificate of accomplishment from school. We can go on the honor roll. We can get a certificate of appreciation from the job. But nothing beats being home and being able to have the encouragement and affirmation to help us build self-esteem and to be healthy in mind, which impacts the body. So we want to be able to, in communicating, get out of our world. If I'm an adult, hear my child. Right now, they're going through experiences. We as adults are feeling the stressors of this pandemic stretching on, and what is done, taking away from us things that we were naturally able to do. Now we have to social distance. We have to wear masks. Children are little people too. We've got to be able to remember that. So think of them. Don't think that because they're children, they're not going through, they're not grieving, that they're not fearful, that they're not depressed. We want to be able to counter that. We talked about it already. To remember everything we talk about, we want to put in the 8 natural laws of health, God's laws of health. Trust, which we talked about in the forgiveness section, is important. Remember, it has 2 parts, and which is the personal and the relational. And then we have to rest, get enough rest. We have to exercise, have fresh air, have sunlight, take care of our diet, those type of things. So we want to make sure that we understand that little people, children, go through what we go through, and the things that counter, that will help them and help us, is those laws of health. And so we want to just go ahead and just talk a little bit more about putting ourselves in another person's shoes. When we want to communicate, we don't want to attack, we don't want to blame, we don't want to criticize. You know, that's the ABCs. And you notice I've said ABCs like maybe this 3 or 4 sessions I've said it, the ABCs. This ABCs, don't attack when it comes to communication. Don't blame, because when people attack, then defensiveness goes up. Remember, our instinct is fight, flight, or freeze. Talked about that. The body is made to survive, and that brainstem says protect, defend. But God says, has created us as human beings to have 5 to 7 seconds for it to come to the frontal lobe along the electricity, the pulse, along our neurons to get to our brain cells to say, what do I do with that? So don't attack. We can think about it. Don't blame, don't criticize, because that would bring up somebody's defense mechanism where their pulse is racing, their pressure is going up, their heart is beating harder, and they're not thinking as clearly with the frontal lobe. So you want to avoid those ABCs. Don't attack, don't blame, don't criticize. Now, we want to show understanding to one another. We want to have the person to feel understood. So understanding is like the listening part of it. I'm hearing you. Whether it's an adult or a child, we want to hear each other. What the person, when we listen, we're doing something, we're giving the person a gift. We don't have to agree with them, understand that, whether it's adult or a child, but to listen with understanding or empathy, putting myself in their shoe. How would I? So as an adult, I have to, talking to my grandchild, I have to stop being a grandma in whatever my age and get into the level of how is my 2-year-old grandson feeling? How is my 13-year-old grandson feeling? What are they going through even as we have this conversation? So I can have the mindset to think of, not as a parent right off the bat or a grandparent, to stifle what they're saying, but to hear them so I can relate in a way to guide them and to be able to speak with them that will help them to grow and to still keep their self-esteem intact and help them to still have a knowledge of God reflected in me. So showing understanding. So it helps the person learn more about him or herself, and it helps us to better understand the person's feelings, thoughts, concerns, and desire. So to listen, you want to listen carefully. You know, I have 2 sons that are totally different. One son, the sanguine, one that is actually joyful and bubbly. I can wash dishes, I can do whatever I want, I can be mopping the floor, and he's talking, and he's okay. While my other son, if he doesn't get my attention, if I'm not looking him eye to eye, he'll come in, hey mom, if I don't pay attention, he's gone. But if I show attention and I say, how are you doing? Right away, he'll connect, he'll start talking. I don't, but for him, if I'm busy, I'm not focused. We have to know, we're going to talk about that. We have to know our children and our spouses in the home. What makes them tick, happy and joyful? What makes them ticked, upset, angry, and irritable? And when we understand that, it helps us as part of our communication, our body language. We have to be able to put into feelings what they're saying, their words are saying. If they're angry, nobody cares about me. They're saying that in words, but maybe they're feeling, I want more quality time. I need some time. What are they feeling? Alone, afraid. What are the feeling words behind the action? What are the feeling? What are the emotions behind the words? So when we listen, we want to not interrupt. Whether it's our spouses or partners or friends, allow them to speak, and then we'll get a chance to speak. But it's important, if we talk over each other, we know, we live it, it does not work. Even for our children, we tend as adults to try to stifle what they say because we think they're children. But remember, they're little people in tiny bodies. They are. Okay, so remember, we're going to listen carefully when we're speaking, put ourselves in another person's shoe, and figure out what are the emotions behind the words. Don't interrupt so that they can actually get it out. The best thing we can do is to practice. It might not feel easy to listen, but we must practice. Listening is a skill that can be learned, but we must practice it to be able to zip our lips and open our ears. So dad listens to mom and vice versa. Parents listen to the children. Brothers and sisters listen to each other. We have to practice it. That's what we do in counseling. Counseling, you know, and I say it all the time, that people pay a lot of money to come to a counselor or even a psychologist or someone for them to say, and how does that make you feel? Because they're listening. Tell me more. Well, we could do that in our own homes, but we don't. So take that as just an extra tip there. We can listen. Listening is a gift. Listening is healing. Listening is bonding. Listening is relationship. That's a big part of communication. All right. So when we listen, of course, we want to know, how do we speak? You know, there's a saying by Robert McCloskey who says, I know that you believe you understand what you think I said, but I'm not sure you realize that what you heard is not what I meant. So does that happen? You say something and somebody takes it another way and you say, that's not what I meant. They said, no, that's what I heard. And that's what but that's why communication is important. So the way we speak and when we speak matters. When we speak, we want to be heard and understood and accepted. We want to be able to share all our feelings, our concerns, and our desires. You don't want to do it openly and honestly. We want to, when we speak, to decrease the other person's defensiveness, the person that's listening. We want them to hear us with an open mind, not with their defense mechanisms up, that survival instinct in where their brain is cloudy and where they're not thinking with the intellectual brain up front, with that frontal lobe. We want to maybe speak so somebody will hear. So we want to think about things before we speak. Is it a good time to talk? Now, especially for women, men are, and my son tells me that all the time. One of my sons, he says, Mom, there is a nothing box. When men say nothing, and my husband tells me the same thing, I'm learning that I have a very quiet husband. You might realize that I like to talk, but he's very quiet. And when he says nothing, they mean it's nothing. The men really mean there's a box marked nothing, and when you go there, there's nothing. While ladies, we are multitasking. We're doing a lot of things at the same time, even though technically we don't really multitask, but that's something else. But what we want to know to talk about is the fact that there is a way that we communicate. Is this a good time to talk? The men may be busy. Suppose that male is going off to work. There's a flat tire. That's not the time the best time to choose to talk to him about a problem with the child. We want to set up the best time to talk. Start with something positive or good. Whatever it is you're going to talk about, you know. You want your child to be able to put the garbage out. They don't put it out all the time. But guess what? We don't want to go in and say, why didn't you put the garbage out, and start railing because their defensive mechanism comes up, and then we are in trouble. But what we want to do is start with something good that the child will say, their defenses come down and they are receptive to hearing. So maybe you'll say, wow, last night you did the dishes without being told. I am so happy you did that. That made mommy feel good, or that made dad feel good, you know, or grandma feel good. You know, the garbage needed to go out this morning and you missed that. What happened? And all of a sudden they're not defensive. They're like, oh my goodness, I forgot. I'll make sure I do it now. Or, oh my goodness, I'm sorry. Because they are receiving something positive before they got the negative, rather than complaining about the garbage and then they stomp off, and then you have to go ahead and go to a higher level of discipline because they're doing something because they're in their defensive mode. All right. When you're actually speaking, you want to speak for your own point of view. You want to say, this is what your behavior is doing that and makes me feel. This is how your behavior makes me feel. So you don't say, you know, you do and you are. You're saying, when this happens, I feel this way. I feel hurt. I feel sad. I feel afraid. You tell how it makes you feel. That's being subjective. And, you know, people talk about it all the time. That so many times where we complain about what the person's action is, what they are doing. And then that increases defensiveness and will get us nowhere. So we want to show understanding before we even speak about our concerns sometimes. That helps. That's an important piece to me. And what I mean by that is, if I'm wanting to say to somebody that I need more help around the house, okay, I want to say, you know, the husband might come in and he's tired. I say the male. And remember, families, I want to put it out there. Families are different kind of nuclear families. We've got husbands and wives and with children. We have husbands and wives that have no children. We have a single mom. We have a single dad who's taking care of his children, raising them on their own. We have step families. So when I talk about family, fit it to your family type. All right. So I'm trying to speak to everyone broadly, but take away the points to help in however your family, nuclear family is situated. Okay. So showing understanding before. So maybe you need help around the house, but your spouse, for example, when you use a spouse or your partner is not paying attention to that need, and you're trying to get some more help around the house. So therefore you might start with the fact that they're working. Show some understanding. Okay, I've been home and maybe they're working. It could be vice versa. It could be the woman that's out and the male is home. With COVID, the scenarios can vary widely. But then what we need to do at that point is say something like, I understand that you're working hard and I appreciate all that you're doing. So I understand that sometimes it makes it difficult and you want to come in and just rest. If you could help me, I know that both of us tell the benefits of it. You know, if we help each other out, I mean, maybe I can sit with you early. If you help me with the kids, help me with getting something done, this done, then you and I can sit together, talk about the benefits of doing it together. But you're showing in a way that I hear you. I understand what you're going through. I am needing this. But together, if we do it together, here are the benefits of us doing it. Hope that makes sense. So if I need help with the dinner, you know, or help doing something, what I want to do is to say, I understand that you were busy or you have a lot to do. Can we carve out some time? Because I really could use some help in this scenario. show some understanding, and that person's defenses will come down. They won't be in the fight, flight, or freeze mode, not saying anything or fighting back, or running away. All right? So that is it for speaking. What we want to do too is to let each other know that they're appreciated. At home, we take things for granted. We tend to do that because it's family. We might be more ready to say to a friend, hey, how are you? I appreciate that about you. You've done this for me. But in the home, no one needs to know how much they are loved and cared about than those you love. Don't forget to tell them. So we have different love languages. The appreciation helps you to feel as if they are loved. It's our actions. Remember the good things that the person has. Now, at home, things may be rough, but because we're together, it'd be like, oh my goodness, I'm going crazy. I need to get out. Well, maybe that's a good thing. Get out into the fresh air. Appreciate that and help the kids and other family members to go out and appreciate it with you. But show love and appreciation. We want to do that. Remember, there are ways, and I know you know of the 5 love languages. I know you do know them. To appreciate and show love, you can do it. Some people like gifts, homemade gifts, purchased gifts, but they're gift giving. People like touch, hugs, and we know, again, talking about health, people get healthier when they have touches and hugs. People in the hospital get well. Children go ahead and they do better in school. So touch is important. So we want to be able to give the love language that the person has. Acts of service. Now, I love acts of service. My husband does not have to buy me anything. I don't know. His love language is gifts. So guess what? He'll buy me something. But my love language, I'll say, thank you for the gift. But my love language is, wow, I came home thinking I had to wash the dishes, but my husband washed the dishes. Wow, that blows my mind. It makes my day. I'm going to be the best wife I can be. So acts of service is my love language. Somebody else's might be quality time, spending time together. And they want to come sit down with me, come watch TV. A child might say, read me a book. Start to learn to look at the qualities, that characteristics of your child, your spouse, even while you're at home during this time. Perfect time to learn those nuances if you haven't gotten them yet. Now, important part for us to know, right, is that when we show love in actions, showing appreciation, right, when we do that, we know that in the home, we're able to bring those things outside. We want to be able to keep on giving so others, when we give, the Bible tells us we give, God gives back to us in return. And God says when we give, he gives back, pressed down, shaken together, and running over. So when we do for others in the family or outside the family, know that God is taking care of us. The way we treat each other helps us to be healthy, helps us to grow, help us to be strong, help us in mind and body to heal. All right? So let me say something right here. When we're talking about love and appreciation, we want to ensure that the love language is something that we're using really can be understood. Because I can be showing understanding by saying, I want to spend time with you, while that person really would rather you do something else. Somebody, Dr. Annie Perez, she's with the Florida Conference, and I love it. When I go to conferences, I glean new things to share, and I love that. I get information that I want to express what I'm sharing in a different way that meets so many needs, different personalities, different styles, different learning. And she says it this way: if I speak English and somebody else speaks French, and I am talking to them and showing them an appreciation and praise, and I'm speaking English, but they only speak French, are they going to get what I'm saying? They won't. So although I'm pouring my all out into them, they're not understanding me. Or somebody speaks German and somebody else speaks, German, and somebody else speaks Spanish. And they're talking, and no matter how much love they're putting in it and how much praise, they're not getting it. So it's important for us to learn our spouse's love language, our children's love language. We learn our co-worker and other people. What can we do? Because yes, we can recognize these things in people, and it will make our lives so much better. to be able to do this. I want us to keep on keeping in mind that in the home, I believe it, is where all the things start for healthy communication. Keep practicing, keep doing things that help you to move on. All right? I want you to know that as parents, the dreams and goals you desire for your children, model it at home. We want you to remember that kids are people too. No matter what I'm saying, remember this. There's a child in every adult. Sometimes we're nicer to our children and we talk with them, we cuddle them and we speak soothing things, but the adult, we say, you should be old enough. You're a big adult. No, there's a child in every adult as well. Also, it's quality time, make it teachable moments. Make sure expect excellence, not perfection, in the home or outside. Remember, during the time of COVID, get the kids out. Get them to get some vitamin D, help them mentally, yourselves as well. You want to be able to show respect, and it's a two-way street, adults to children and children to adults, many times in the home. Part of our communication is communicating God's love, and our children see us, in us, God. We are the gods to them because they don't know God yet, but it is our job for God in us to come out so they see God in us. I hope you got that. Trust is learned and not earned. We said that in another segment. We've got to know that don't expect to get trust if we're not doing things that are trustworthy. We might believe we're doing well, but hear from our partners, hear from our children, hear from others around us. What are they saying about us to know if there's trust? And there is, parents, I want you to know there's power in a five-letter word. Five-letter word. What is that word? I am sorry. Sorry. I mean, I said a sentence, but be able to tell your child, I'm sorry. When we get on each other's nerves in the home, when we just can't get along because of the stresses, be able to say, I'm sorry to people around you. That is a healing word, very healing. And also, make sure the child's self-esteem, somebody else's self-esteem, your spouse, your partner, again, whether you're in nuclear family, is husband and wife alone, husband and wife and child, single parent, single individual at home. Yes, treat yourself too. Even a single individual at home, you are a family. So even you, and remember, connect to the church family. What we don't have in our biological family, we can actually put together in our church family. And if we're not safe anywhere else, we can be safe in our homes, should be safe in our homes, and should be safe at church. So I hope these tips are helpful to you as we talk about building up, affirming one another, reinforcing good things. Listen more than we speak. In communication, it's important to listen more than we speak. And speak in bite-sized portions for the young ones, make it age appropriate how we speak to them. And parents, give options to those children, teach them, and help them to understand about God and relating to one another. Model it for them so they can see it. Show examples in the way you live in the home. Well, I hope those were helpful little hints and tips on communicating in the family. So we did family and communication in one. May God bless you. Hope you really received something from it. I look forward to us meeting again. So let us pray. Father, thank you for your goodness and your grace. We thank you for your mercy. We thank you that you are with us. Father, the Bible tells us that you put the solitary in families, meaning those who are alone, you put them in families. Some people are alone right now. They have no one else. And they're saying, am I a family? Yes, they are a family. And you say you put the solitary into families, meaning you put people who are alone or isolated into families. Lord, the pandemic has had us isolated. I pray, Lord, that you will just be with us, direct us, guide us, so that, Father, we can remain healthy and resilient and find the strength we need in our personal home, our biological nuclear family, as well as our church family. May each of us strive to be more like you so that others can see you in us during this time. In Jesus' name, amen. Thanks again for joining. Hope to see you again.
Something big is happening on November 7, 2020, and you don't want to miss it. The Southeastern Conference Women's Ministries Department is celebrating its 30th anniversary. The theme is 30 years of excellent service. The best is yet to come. Prepare yourself for a full day of virtual interactive programming with powerful preaching by our keynote speaker, Chaplain Linda Pinnock, founder of Living the Divine Purpose Ministries. Enjoy inspiring music by our anniversary praise team and virtual choir. And join us for a special tribute acknowledging the excellent work of former Women's Ministries directors, Sister Vanessa Melton and Mrs. Nicole Rize. In the afternoon, get ready for a spirit-filled live concert with gospel recording artist Miranda Curtis, a special awards program honoring women around the conference who have contributed greatly to the work of women's ministries, followed by an anniversary reception and a celebratory toast. If you would like to nominate an outstanding woman for an award, visit www.seccsda.org/women's ministries. Registration is open now to receive your personalized 30th anniversary gift box for a donation of just $30. Anniversary t-shirts are also available, and take a moment to place an ad in our commemorative booklet on behalf of an outstanding leader or in memory of a loved one. To receive your package by November 7, orders must be placed by October 16, 2020. For more details and to register right now, visit www.seccsda.org. You may also register using the SEC SDA mobile app. Download it today for free. This celebration will not be complete unless you are there to share it with us. So mark your calendars now.